became excited that it might be a solvable problem.
A Calgary doctor saw the need for more ventilators as the COVID-19 pandemic worsened around the world. So he created a solution, a device that can essentially turn one ventilator into 4.
I finished a long shift. I have a nap, and then I worked on this project when time allowed.
The demands of working on the front lines of the critical care unit didn't stop Dr. Stephen Roy from problem solving.
At the beginning of the pandemic, there were ventilator shortages and foreseen ventilator shortages, and people were discussing splitting a ventilator.
Traditionally, there are 2 big barriers when it comes to people sharing ventilators, each individual needing their own breath pressure and making sure individuals aren't sharing air.
I discovered a solution that actually seemed like it could safely split a ventilator and do the job that needed to be done.
Working on prototypes in his garage after his shifts, he eventually came up with the Valence Invent Extend being demonstrated here. And the cost? About $50, far less than the $70,000 one ventilator could cost.
For a developing country, this is a humongous difference in terms of being able to afford to support more patients.
Right now, the product is awaiting approval from Health Canada. Eventually, it would need to go through licensing for every country it would be used in, but the potential is game-changing. The invention is already getting international recognition, and Roy hopes it will soon be available far beyond Canada's borders.
That's certainly why we worked on it, with the hope that we wouldn't have to decide between saving one patient or another, that we could potentially save both of them.
In Calgary, Cara Campbell, City News.